The new Mobile Integrated Healthcare Program by the Ketchikan Fire Department aims to kind of meet the needs of any of our community members who may be falling through some of the gaps that they can experience living in a rural place such as Ketchikan. The main thing to know is that we're not going to be replacing primary healthcare providers, we're going to be supplementing them, helping them. We're aiming to help those who are struggling to get their basic needs met, community members such as seniors, homeless, or just general vulnerable population here in Ketchikan. So there's going to be a lot of different types of services we provide, and initially we were looking to have a very expansive program, but as we've kind of come along, we've narrowed down the focus. The last thing we wanted to do was kind of have a cookie cutter program that we copied from some other city or some other state. We've learned that Ketchikan's a unique place and it needs its own unique solution. So some of the areas we're going to focus on initially are going to be vulnerable populations, follow-up care if you're getting discharged from the hospital, or if you have an ambulance come to your house. We'll check within the next week or so, see how you're doing, see if there's anything you need. Try to coordinate with the healthcare providers on the island for you. We're going to be able to look to help people who have high utilization of EMS and ER services. So when people's basic needs are getting met, it's going to fall to EMS and to ERs to help fulfill those needs. We're going to try to come up with care plans for these patients to help them get the care that they need more appropriately and safely, so that they don't have to rely on emergent services just for health care. We're also going to try to focus a lot on outreach and education, meeting with senior centers, schools, whatever it may be, to try to focus a lot more on prevention rather than just responding to emergencies. See if we can't reduce the amount of emergencies overall. We have a transit van that we'll be utilizing, and think of it kind of like a mobile clinic. It doesn't have the capability to be transporting patients. That's a service that we're looking to expand into in the near future, but the mobile clinic van will be able to provide all types of services at patients' homes or just out in public. So when we're out and visiting with patients, whether it be at parks or at patients' homes, if the home or that meeting place isn't conducive to the type of examination or interaction we're having with that patient, we can bring them into the van. It'll be a little more private. We're looking to outfit it with ear, nose, and throat examination capabilities. We're going to be able to do everything an ambulance can do minus the emergent care part. So assessments for physical well-being, we'll be able to do wound care, help you with that. We can do such things like cardiac assessments, listening to your lungs, anything that a primary care provider would maybe want follow-up on, we'll be able to help them meet those needs. So the new MIH program is going to be based out of the main station here down on Bodden Street. We have our office upstairs on the 3rd floor, and something important to note, we are not going to be dispatched emergently. If you think you would like to utilize our services, you can talk to your primary healthcare provider who can give you a referral to us, or you can give us a call on our voicemail only line. Other than that, if you have a primary care provider who wants to refer you, we have forms on our ambulance that our crew members will be able to give to you and have you fill out, and that way we can follow up with you at a later date, set up an appointment, come visit you at home or wherever it would be most helpful for your needs. You're going to see us out in the community all over the place. You'll see us at senior centers, you're going to see us at libraries, at schools. We'll be spending time just in the general community at parks. Anywhere where we see a need that's not being met, we're going to try to come up with some unique solutions to fill those gaps. Initially, as the program launches, we're going to be working primarily between the hours of 8 and 5, Monday through Friday. And as the program progresses, if we expand, get more staff, or see needs for different hours or even weekends, that's something we will look into and potentially expanding further down the line. In the van, we have room for 2 providers and 2 areas for patients to sit in for assessments. In those spots, we're going to have things like ear, nose, and throat tools. We're going to have blood pressure cuffs. We're going to have cardiac monitors, stethoscopes for lung assessments. We have a refrigerator where we can keep temperature-sensitive medications or even vaccines. We're looking to do vaccine administration in the future. There's also going to be a privacy curtain where if we're doing something a little bit more intimate or something that we need more patient privacy, we can put that curtain up and really make the patients seem more comfortable. When we're doing community outreach, some of the things we're looking to incorporate into the program are going to senior centers, whether that's helping seniors fill out medical forms to post on their refrigerators so 911 responders have better information. They're more able to take good care of their patients, whether it's things like going to senior centers and teaching staff members first aid, CPR, so they're able to help their community members more efficiently. We can go to schools, do the same thing, or whether it's going to shelters or out in the community and giving education about opiate overdoses and Narcan administration. When the program launches in June, you're going to see us out about in the community. Feel free to say hi to us, ask us questions. We're going to be able to come to your home, have a conversation about what types of services we can provide and really help you with, get to know you, see what your needs are. Feel free to stop any of the guys on the Ketchikan Fire Department crew. They'll have referral forms and have some information for you. Feel free to give us a call. We have a voicemail only number, and as always, feel free to stop by the station and have a chat with us up on the 3rd floor.